In a country that makes up just 5% of the world's population, yet consumes 80% of its opioids, the opioid crisis has claimed hundreds of thousands of lives. 115 Americans die every day from overdoses, but there's hope on the horizon. Recent studies reveal that cannabis, a natural alternative, can not only enhance pain relief, but also reduce dependence on these highly addictive drugs, offering a powerful tool in our fight against this devastating epidemic. Welcome, welcome. Thank you so much for joining us. I'm Dr. June Chin. I'm the Chief Medical Officer of Leafwell, and Leafwell stands tall as the largest virtual care clinic for integrative medical cannabis. We provide 24/7 access, offering not just clinical and emotional support, but also dispensary assistance, personalized product recommendations, protocols, and affordable pricing. We ensure that every patient, no matter what their journey, gets the support that they need. Our mission is to empower you with the latest information and support to help you make informed decisions about your health and wellness. So welcome to our first webinar in a series we'll be hosting every month. And today we're going to dive into the fascinating history of cannabis as medicine. We're going to explore the science behind why it's effective for managing chronic pain. And then after our review, we'll open up the floor to a Q&A session where you can ask questions, join in the discussion. And we are just so excited to have you here. And we are looking forward to a great conversation. I do want to note that the information provided in this webinar is intended for educational purposes only. It does not constitute medical advice, and viewing this content does not create a doctor-patient relationship. For more personalized medical advice and treatment, please consult your licensed healthcare professional. So I was a cannabis patient before I even became a doctor. As a teenager, I was diagnosed with ankylosing spondylitis. And ankylosing spondylitis, or AS, is a very progressive type of arthritis. It affects the spine, the hips, the pelvis, and the back, and it causes extreme stiffness and nerve pain. So I spent my younger years trying conventional treatment. I mean, you name it, I have tried it. Epidurals, narcotics, muscle relaxants, acupuncture, physical therapy, but the pain was just unrelenting. And by the time I got to medical school, and this was in San Francisco, I was having a hard time standing for long periods of time. And I had the best pain specialists in town, all right? I tried various medications, gabapentin, I tried Flexeril for muscle spasms. I was even given various antidepressants, such as Cymbalta. And when the doctors ran out of things to prescribe, they even gave me oxycodone for my pain. Well, the problem was that most of these medications made me really, really nauseous. So, of course, they gave me anti-nausea medications like Zofran. At one point, I was put on really high-dose steroids to try and get the inflammation and the pain down, and nothing was helping. You know, here I was in a hospital. I had access to any specialist that you can imagine, but I was really disheartened. You know, I was really, really sad because nothing could help my condition. So Dr. Levine, he was an HIV and AIDS physician, and he pulled me aside one day and he handed me this tincture. He said, "This is marijuana, but it won't make you really high." Now, he didn't call it CBD oil or anything fancy like that. He just said, "This is a different type of cannabis plant." And I grew up in a very traditional Chinese household. My parents believed in reefer madness, and they taught me that weed led to psychosis and schizophrenia. And this little brown dropper bottle that Dr. Levine handed me smelled awful. It smelled awful. It smelled like a combination of alcohol and wet dog and grass. And I didn't know what to think. But to my amazement, the tincture worked really well. You know, my pain, my inflammation of my arthritis decreased dramatically over time. My AS stopped progressing. So my disease stopped progressing and my health improved. Now, I want to bring your attention to the pain prescription that I was given, oxycodone. I was prescribed oxycodone, and it belongs to a group of medicines called narcotics. Now, opioids are frequently used to treat moderate to severe pain. Example of opiates are buprenorphine, codeine, fentanyl, hydromorphone, methadone, morphine, oxycodone, tramadol. You might have heard these prescriptions before.
And opioids can be useful when used intermittently and for less than 1 month at a time. Opioids are powerful substances that significantly affect the pleasure receptors in your brain, making them highly addictive. It's important to remember that just less than 10 years ago, companies like Purdue Pharma were promoting the safe daily use of opioid-based medications in their TV commercials. They highlighted how widespread and normalized their use was. In the mid-1990s, Purdue Pharma started advertising OxyContin, which is a type of medicine for pain. And they said it was very safe. It wouldn't cause problems if you used it for a long time. They even suggested that you could take it easily, like candy, and be okay. Unfortunately, this made it easier for people to get addicted to the medicine, which became a big problem called the opioid crisis. And the numbers are quite shocking. Even though here in the United States, we make up only 5% of the world's population, we use 80% of the world's opioids. In 2016, the number of people who died from opioid overdoses was the same as the total number of American soldiers who died in both the Vietnam and the Iraq War combined. Yeah. In the US, most overdose deaths, 66%, in fact, involve opioids like oxycodone, hydrocodone, methadone, heroin. And this number has increased 5 times since 1999. From 2000 to 2016, 600,000 people died from overdoses of opioid drugs, which means about 115 people die every day. The highest number of fatal overdoses happens among people aged 25 to 54. Now take a look at this. According to the CDC, if a patient gets a 6-day prescription for opioids, there's a 12% chance they'll still be using them a year later. If the prescription lasts 2 weeks, that chance doubles to 24%. For a month-long prescription, the chance rises to 30%. Now, the bigger challenge is helping people stop using the opioids. Quitting suddenly can cause very unpleasant withdrawal symptoms. We're talking nausea, chills, heightened anxiety, panic attacks, difficulty standing up. We call that jelly legs, and confusion or delirium. Despite the myth that marijuana is a gateway drug, recent science shows that cannabinoids, so the molecules in the cannabis plant, can actually improve the pain-relieving effects of opioids and help reduce the need for higher doses. So this can also ease the harsh symptoms of opioid withdrawal. Studies have found that 68% of patients who use marijuana along with opioids successfully switch to using marijuana instead of prescription drugs, which includes opioids. There's a study at the University of Pennsylvania School of Medicine, and they found that when a state passed a medical marijuana law, opioid overdose deaths dropped significantly by 25%. So I want to talk to you a little bit about the history of cannabis and where it came from. Cannabis has a long history of medicinal use, dating back to ancient China around 2700 BCE, where it was used to treat ailments such as rheumatism and malaria. In ancient Egypt, cannabis was used for its anti-inflammatory effects, for treating infections and depression. The Greeks employed cannabis for pain relief, wound healing, ear infections. And by the time the 19th century came around, cannabis extracts were widely prescribed in England for different conditions, including migraines, muscle spasms, and menstrual cramps. In fact, the very first issue of The Lancet, Queen Victoria's doctor wrote about using a tincture of cannabis to treat dysmenorrhea or painful periods. It was used for migraines at that time, neuralgia, which is nerve pain, and it was used to help tremors, thought to be from Parkinson's disease. In the United States, physicians also made their own cannabis tinctures and sold them right out of their own offices, as did drug companies like Eli Lilly, Park Davis, and Squibb. So what's the situation now? As of 2024, people in 38 states can use medical marijuana, and 24 of those states can use it for adult use. And this is changing monthly. Each state has its own different rules about how it can be used and what it can be used for. And even though some states allow it, marijuana is still illegal in the whole country according to federal law. Okay. Now, because of this, doctors such as myself can't officially prescribe it. We can recommend it, and people can't take them across most state lines. Recently, though, the White House announced that they want to move marijuana to Schedule 3, which is the same category as steroids, testosterone, ketamine. And this change would show that marijuana is considered less risky compared to drugs like fentanyl and meth, which are higher risk categories. And the Justice Department is now working on making this change official. So let's briefly talk about endocannabinoid system, also called the ECS. The ECS is like a special control center in your body. It works with all those other systems, like the ones that help you breathe, digest food, move your muscles. Think of the ECS like a dimmer switch. It can adjust how bright or warm things are. It can adjust how your body manages blood sugar, how your immune system works. It adjusts how you feel pain and pleasure, or even how your body uses energy. It helps keep your body in balance. So even though the endocannabinoid system might sound like it has to do with cannabis, it really actually doesn't have to do with cannabis. The endocannabinoid system controls different parts of your body independent of cannabis. It includes how you handle stress, how your body deals with things like having a baby, right? So it keeps everything in balance for you. When you're sick, your ECS works hard to help you get better. It's really important for your overall health and feeling good. And let's learn about how cannabis works in your body. So cannabis molecules, cannabinoid molecules, are like tiny messengers that help send signals to our bodies. They talk to special parts of our body called cannabinoid receptors. And these molecules can come from 3 different sources. They can come from endogenous cannabinoids. So endogenous means it's made by our own body. So just like our bodies make hormones and other important stuff, they also make these special messengers all by themselves. Anandamide is one of them. And this one is named anandamide, which means bliss, because it makes us feel happy. 2-AG, this one helps our body stay balanced. And both of these messengers are made only when our body needs them. Number 2 of cannabinoid molecules are called phytocannabinoids. Now, phytocannabinoids are produced by the cannabis or the marijuana plant. And then number 3 are synthetic cannabinoids. Now, synthetic cannabinoids were produced artificially by pharmaceutical companies since the 70s, since the 1970s. Some of you may have heard of this synthetic cannabinoid called Marinol or dronabinol. It's a THC synthetic. It's used to increase appetite in cancer patients. Medical cannabis can help treat a number of conditions. Like I said, Alzheimer's, appetite loss, cancer, Crohn's disease, disease affecting the immune system, like HIV and AIDS, eating disorders like anorexia, epilepsy, glaucoma, mental health conditions like PTSD, MS, nausea, pain, Parkinson's disease, and wasting syndrome. Now, cannabis is a very complex plant. It's a complex plant containing over 500 unique chemical compounds. The therapeutic compounds present in cannabis fall into 3 main categories: terpenes, cannabinoids, and flavonoids. We're going to talk about the cannabinoids. Now, these are special molecules within the marijuana plant. The 2 that we'll focus on today are the most popular: CBD and THC. They're also the most researched as well. THC is an important ingredient in cannabis with different effects. It can create euphoria or a high, right? It makes you feel very happy, very, very excited. It can be sedating or relaxing, helps you feel calm and relaxed. THC reduces pain. THC reduces muscle spasms, so it helps ease muscle cramping and twitches, stops nausea and vomiting, stimulates appetite, helps make you feel hungry, gives you the munchies, reduces anxiety and depression, right? Can help with your feelings of being worried or sad. It also helps fight against tumors. Now, there are some common side effects of THC: feeling dizzy, dry mouth, feeling sleepy or tired. You might have coughing or some phlegm when you smoke THC, feeling anxious. Some patients are very sensitive to THC, and it can make them feel sick and vomit. Some problems include thinking clearly, headaches, feeling sad, or low mood. So sometimes THC and A small amount of patients will have the opposite effect. So some patients actually feel more sad with THC. A fast heartbeat lowers blood pressure. And just to have you know, not everyone experiences all of these side effects. It really depends on how much THC you use. And we'll go over that in this webinar as well. Now, CBD is one of the more important ingredients in cannabis as well, right after THC. And it's known with helping with a variety of health issues. Some of the things CBD might help with are reducing pain. So it makes the pain feel less intense, turns the volume down on pain, helps with anxiety, improves sleep, reduces inflammation. So it helps calm down parts of the body that are swollen and irritated. It is an anticonvulsant, which means it helps reduce seizures. It helps protect the brain and nerves from damage. It's a neuroprotectant. It might help against tumors as well. So CBD is really helpful for different health issues. As far as side effects, CBD doesn't have many side effects. I would say the most common side effect would be a stomach upset. So you might feel a little queasy. Sometimes some patients have loose stools, but this is usually because of that extra stuff that's added to the CBD oil. So patients are sensitive to the CBD oil, the additives to the CBD oil, but not the CBD itself. There are 3 main types of cannabis plants. The most well-known are cannabis sativa, cannabis indica. Sativa is often used for making different products and is known for its uplifting effects. Indica is known for helping people relax and unwind. And I do want to note that most of the time, you won't find a plant that is completely sativa or indica. Instead, you'll find blends called hybrids that mix both types together. And each type and blend has different effects as well. The active ingredient in cannabis are, like I mentioned before, cannabinoids and terpenes. And terpenes are the chemicals that give cannabis its pungent and earthy odor. And they're very beneficial. Terpenes are the special, I call smell molecules. So it can really influence how that cannabis can make you feel. They make the smell of cannabis earthy and fruity, kind of like how different flowers and fruits have their own unique scents. Terpenes aren't just about smell of the cannabis plant, but terpenes can change how the other parts of the cannabis plant, they're called cannabinoids, work. So let me explain this a little bit more. Think of terpenes like a spice in a recipe. Just like spices can make each dish taste different, terpenes can affect how cannabis can make you feel. So for example, myrcene might make you feel relaxed, like after a long day. Limonene can make you feel happy and energized, like eating a juicy orange. Pinene might help you breathe easier and stay focused, like the smell of pine needles. So terpenes are a really big part of what makes each cannabis so special. Now, there are many different ways of delivering cannabis into the system, and each of them have pros and cons. When you smoke cannabis, it goes into your bloodstream very quickly. You feel its effects right away, and it lasts about 1 to 3 hours. So if you're new to using cannabis, a good idea is to wait at least 10 to 15 minutes between each puff. This helps you avoid using it too much and feeling side effects. Vaporizers are special devices that heat up oils without burning them, and they get hot enough to release the good parts of the plant, right? Those cannabinoids and terpenes I just talked about, but it doesn't burn it, which is better for your lungs. Now, tinctures are medicines that you put under your tongue, and this is a quick way for your body to absorb the medicine because it doesn't need to go through your stomach like other medicines. Now, edibles. Edibles come in many different forms, like candies, gummies, chocolates, even powders that you can mix into your beverages and capsules. If you want the benefits of cannabis, but you don't want to eat it or smoke it, you can use topicals, cannabis topicals. And topicals are creams and lotions that you put directly on your skin. They start working right away, and they're really helpful with things like localized joint or muscle pain. You can use it on burns that have healed over, eczema, psoriasis, even acne, because remember, CBD is an anti-inflammatory. So I have a lot of patients that actually use it for eczema and psoriasis and skin conditions to decrease the inflammation. Now, the effects usually last between 30 minutes to 3 hours, and the cream or the ointment works best when it's made with special penetration ingredients, which means it helps get through your skin and helps get absorbed better. Okay, that was a lot, but I want to make sure that we have time for questions. Q&A is usually the best part, because then we can answer some of the common questions that you guys have. So first question I have here is, how addicting is medical marijuana? What a great question. A lot of people ask me this. How addictive is marijuana? And to answer this, I want to show you this chart here. And this chart is from the National Institute of Drug Abuse. Okay. This chart shows that tobacco, like cigarettes, is the most addictive. You see it here at the top. Tobacco is right at the top at 32%. So this means 32% of people who use it become dependent. Okay. And caffeine, you see caffeine on the bottom at 9%, and cannabis is on the bottom at 9%. So caffeine, like coffee, for example, marijuana, only 9% of people becoming dependent on them. So this means while marijuana can be addictive for some people, fewer people who try it become heavy users compared to things like you see here, heroin, cocaine, alcohol, and tobacco. So that's a great question. Okay, next question. What studies have been done on using medical cannabis to treat chronic pain? Okay, so let me show you here. If you go to our website at Leafwell, I want to show you here the Leafwell research dashboard. This is what it looks like. It's a cutting edge tool that researchers use to analyze all cannabis related studies from around the world in real time. It gives you the latest, most comprehensive insights into how cannabis is being used and studied globally. So it really helps you stay informed and make better decisions about your health. And you could share this with others and even your health providers, for example. If you take a look at this, here's what we found from our research dashboard on medical cannabis and pain. We looked at 516 studies. So it pulled up 516 studies around the world. 405 of those studies, which is almost 80%, showed that medical cannabis worked well. 76% or 76 studies or 15% had neutral results, meaning they didn't show a clear answer. And then finally, 35 studies or 7% showed that it didn't work. So you see here, let's drill down a little bit. Let's drill down to the specifics of our dashboard. Out of 101 studies, THC, 76 were positive. For CBD, 99 out of the 127 studies show that positive as well. And for other compounds, 20 out of the 26 were positive. So overall, research studies show that medical cannabis can be helpful for pain. Now, we all know that people have had health challenges. Our goal at Leafwell is to help you feel confident in making the best healthcare choices for yourself. So it's important to understand both the benefits and the risks of all medications. And we want to make sure that you get the best and the safest care, not just hand you a prescription and send you on your way. Our mission is to support you in finding the right treatment that works best for you. Okay, another question. If someone is already taking strong pain medicines, is it safe to use medical marijuana too? Yeah, the answer is yes. Sometimes using or adding medical marijuana can make the pain medicines work better. People might be able to use less of their pain medicine or even stop using it altogether. Plus, medical cannabis can help with the tough feelings and cravings that come when you're trying to stop using certain medications, like I mentioned earlier, opioids. When doctors use medicine, for example, for people who are chronically ill or have a chronic disease, we have to think about how safe is this medicine over a long period of time, right? So using medical cannabis, medical marijuana, along with other strong pain medicines like opiates, for example, is surprisingly safe. The reason is that medical cannabis affects different parts of the brain compared to opiates. Now, opiates can be very dangerous because they can stop the heart and the lungs from working if you take too much. So you can overdose. But medical cannabis does not have the same effect on the parts of the brain that control breathing and the heart. So what that means is you can't overdose from medical cannabis in the same way that you overdose from opiates. I mean, you can't overdose from medical cannabis at all, actually. Next question, how is medical cannabis different from NSAIDs? Okay, that's a great question. NSAIDs are non-steroidal anti-inflammatory drugs, and they're most commonly used drug class in the world, actually. It's estimated more than 30 million people use these medications on a daily basis. They account for 60% of the analgesic market in the US. That's significant. These medications work by blocking the chemicals in your body that cause pain and swelling. So here's a picture. I'm going to show you these various NSAIDs, and you might be familiar with them. And I bet your health providers have recommended most, if not all of them. I do want to make a note. Taking ibuprofen can be dangerous. Ibuprofen can be dangerous for patients with kidney disease or failure, dangerous for people with liver damage as well, and people with conditions that put a strain on their kidneys, like high blood pressure, heart failure. So when you take ibuprofen for a long period, it can increase the risk of stomach ulcers. So to reduce these risks, don't take the maximum recommended dose of ibuprofen or an NSAID for more than a week or two at a time. Think about cannabis as an alternative. Cannabis can help with inflammation and pain, just like NSAIDs. It's a very similar mechanism of action. However, cannabis does this in a different way, and it's easier on your stomach. So unlike NSAIDs, which can sometimes upset your stomach or cause other problems, cannabis is a more natural option that doesn't have those side effects. So it helps with pain and inflammation without the stomach issues that some of these NSAIDs can cause. And our next question, how do you know what medical cannabis products to recommend? There are so many. Yes. Over the last 4 years, our providers have helped over 400,000 patients. And these patients with so many different types of chronic pain, arthritis, fibromyalgia, small fiber neuropathy, diabetic nerve pain. Well, at Leafwell, we are combining smart technology with personal care to make sure that you get the best possible treatment. So we are using real patient experiences to guide our recommendations to improve your health journey. So for example, a chronic pain patient, our database looks at all of our chronic pain data to suggest the pain cannabis products for you and to give you the right dose. This helps doctors give better, more personalized care. So for example, we're asking questions to our patients like, which type of cannabis formulations did you prefer? What type of delivery methods? How often are you purchasing it? What times of the day are you using it? Why do certain cannabis products work better for men and not women? For our menopausal women, for example, there are certain cannabis strains that increase hot flashes. There are certain cannabis patients that need to increase cannabis on certain days of their menstrual cycle. So at Leafwell, we're looking at cannabis usage adjusted to age, gender, weight, physical activity, genetic tests, blood tests, wellness, exercise goals. We keep track of what cannabis products that patients like, how they use them, how well they work. We also record things like how it fits with their other medications or supplements you take. So with Leafwell, you spend less money trying different products that might not work. You get fewer side effects. You find relief faster. So our technology uses the experience of many doctors, hundreds of doctors, not just one doctor, to help you get the best treatment. And, we understand a huge amount about our patients because our patients are telling us not only about their cannabis usage and preferences, but they're telling us about their lives. As you saw from our research dashboard, thousands of our patients help us with medical cannabis research by sharing their experiences. And this helps us understand what works best and informs new health guidelines. And finally, our last question, how do I talk to my doctor about medical cannabis? When talking to your local doctor about medical cannabis, here's a helpful approach. Start with your health needs. Explain your health issues, why you're considering medical cannabis as a treatment option. Share any symptoms or conditions that haven't been well managed by other treatments. And then ask them for their perspective. Let your doctor know that you're seeking professional opinion. Ask if they've had any experience with medical cannabis or if they can recommend any resources for learning more about it. Share any reliable information that you might have. If your doctor is not familiar with medical cannabis, that's okay. Provide them with reputable sources and research studies. Point them to the Leafwell research dashboard. Tell them, I have found some research that shows that medical cannabis can help with, my condition, my chronic pain. Can we explore this option together? And then discuss your options. Ask them if they can refer you to a specialist who's experienced with medical cannabis, or if they can collaborate with the Leafwell network. This way, you'll have a supportive team You'll have an entire team that includes both an integrative cannabis doctor and your local doctor, and we will all work together to empower you with the best care. Keep the conversation open. It's okay if your doctor is not familiar with medical cannabis, but the goal is to explore options together and find the best approach to your health. Now, if your doctor dismisses you or makes you feel uncomfortable about your choice to explore medical cannabis, here's a way that you can address it respectfully. Start by saying something like, I feel disheartened by our conversation about medical cannabis. It's important for me to discuss my options openly. And finally, if the conversation doesn't go well, consider seeking a second opinion, from another healthcare provider who is more open to discussing medical cannabis. At Leafwell, we understand that every person's background and lived experiences are unique and can greatly impact their cannabis health journey. This is why we prioritize empathetic approach to care. We integrate culturally humble care at every level. We have a diverse team. So more than half of our providers are BIPOC, 42% of our providers are women. Leafwell offers multilingual support with providers speaking over 35 languages, right? We know there are cultural biases. I grew up from a Chinese household, so there were cultural biases from my perspective as well. But this diversity helps us understand and meet the needs of different patients and communities. We have a wide reach. We have over 30 specialists, rheumatologists, oncologists, endocrinologists, gastroenterologists. We collaborate with a variety of doctors and wellness experts, especially in areas where medical services are limited, medically underserved areas. We want to make sure that everyone has access to good care. And then finally, we recognize the unfair history of cannabis laws and prohibition. We work to ensure that everyone is treated equitably in our care. So visit our website at leafwell.com, schedule an appointment with one of our health providers, and they can help you learn more about how medical cannabis might benefit you. And finally, I guess I'll end by saying that cannabis stands out because cannabis is unlike any other drug that we use. We use cannabis recreationally and medicinally, and there's no precedent for it. This is what makes it so unique. But patients really should advocate for their health providers to become well-informed about cannabis. From what we observe at Leafwell, cannabis really empowers patients by giving them greater control. It gives them greater control over their lives and their health, and it helps them manage their well-being in ways that are effective, that are efficient to their needs. And really, as healthcare practitioners, it's our responsibility. It's our responsibility to engage in meaningful conversations with patients about the science behind cannabis, about the potential risks, about the potential benefits. And by doing so, we're really supporting our patients in making informed decisions and achieving the best outcomes. I want to thank you all for joining us today. I want us to continue working together to advance our understanding of cannabis in healthcare. And I'll see you next month for our webinar. Thanks so much. Bye.